This is the Standing Up to POTS podcast.
I'm Jill Brook, and today we are hearing from POTS specialist, Dr. David Saperstein. He is a neurologist at the Center for Complex Neurology in Phoenix, Arizona. I think you also specialize in neuropathy, right? I think, in fact, you do a lot of speaking and teaching about neuropathy. Yeah, can you talk about neuropathy and how it relates to POTS?
Sure. So when I started in neurology, we always knew there was something called small fiber neuropathy. I mean, we know that nerves have fibers of different sizes. So there's little ones, larger ones, and then larger still, and they all do different functions. We didn't have good ways of testing for small fiber neuropathy. So just around 20 years ago, the technique of doing a skin biopsy became available, but was mostly a research tool. About a dozen or so years ago, it became, easily available where you could just order it. And so we've learned more about it and why there's this subgroup of patients. Why is it a big deal that it's purely small fiber? Again, part of it is diagnosis, because our standard test, nerve conduction studies, EMG, will be normal in somebody who has a small fiber neuropathy. So there are these groups of patients where, okay, some of them, you really seem like you have a neuropathy based on your symptoms and other factors based on your exam, but it was harder to prove. But then we realized there were patients with what would seem like odd symptoms. Symptoms would come and go, numbness and tingling. It would be multifocal. Most neuropathies start in the feet and move their ways up. When we did more and more of these skin biopsies and could demonstrate small fiber neuropathy, we realized that was part of that could be part of small fiber neuropathy. And then it's like, well, what do small nerve fibers do? So they're in the nerve endings in our skin and involved in pain and temperature transmission of those sensations. But then they play a big role in the autonomic nervous system. So some people will just have sensory features. Some people will just have autonomic. More often than not, people can have both. And so we came to realize that small fiber neuropathy was very often associated with autonomic conditions. And we know there's a link between POTS, although we're not exactly sure. So, if you test people with POTS, do a skin biopsy test to look at their small nerves, close to half, maybe not, a third, or some studies, a half of them will have a small fiber neuropathy on that test. That led to this term neuropathic POTS. So this idea that some people with POTS, the nerves that control how tightly the veins and arteries squeeze aren't functioning right. And so this idea of blood pooling, you stand up and you get purplish feet and you're getting too much blood collecting in your lower body when you're standing. And that's why people have POTS. And that certainly is a factor in it. And there are some patients where that's probably the whole or main factor. We're still trying to sort out that story. And we know that if you biopsy POTS patients, some of them will have an abnormal test, some will have normal, and their symptoms can be very similar. So patients can have sensory symptoms, or do often have sensory symptoms with their POTS. And you would think those are the ones more likely to have an abnormal skin biopsy, but not always.
Okay, fair enough.